Hi, I'm going to talk about a day in group that I had about a week ago. It was the worst group I think I had so far besides my first day. My second day that I was in Camden, I had um, a girl who talked about very emotional things, and I didn't think that I was going to be able to deal with it, so I kind of just looked at the floor, and it was very challenging. But then this week was probably the worst group that I've ever seen. I mean, it was educational, but it was very sad. Um, All right, prior to this group day in Glassboro, about 2 weeks ago, about 3 weeks ago, there was a girl in the IOP group, and she had failed a drug test. She tested positive for cocaine. Now, this girl has been clean, well, was clean for a long time. She completed the IOP group, which is 12 weeks, 3 days a week for 3 hours a session, and she made it to the continuing care group. Now, the continuing care group meets once a week for 12 weeks for 2 hours. And then after that, the client has complied and completed her intensive outpatient program. So this client had made it to the continuing care group and she relapsed. So since she relapsed, they brought her back down to another level, which is the IOP group. So now she has to basically start over the IOP group, finish the IOP group, and then move up to continuing care again. The client tested positive for cocaine, which is not her drug of choice. But so she was in the IOP group and she failed two more drug tests. Now we were in group one day and she got really emotional and she walked out of the group. The counselor asked me to follow her. So I went with her. She was really distraught because she just had admitted that she had used and failed 3 drug tests. Now I was sitting with the client in the hallway and she was upset and she asked me if there was any way if I could ask the counselor to not drug test her because she was going to come up positive. And as mandated reporters coming up positive, it has to be reported because she has her children in her care. I told her that that is impossible. She can't ask that. And she really just wanted to not get drug tested that day, give it a few more days to get the cocaine out of her system so she wouldn't fail another drug test. But that's just not how it works. So she failed another drug test about a week later. So that was her fourth or fifth one, and it came up with alcohol. The ones prior to that were all cocaine. Now, alcohol is her primary drug of use. That is the reason why her kids were taken away months ago. She had gotten a neglect charge because her kids were running the street because she was out getting intoxicated. But those charges were dropped, and she was ordered to do the IOP program, which she almost completed. So during group last week, the counselor thought it would be a good idea to address the client on another failed drug test and get the other clients in the group, their feedback to help her. Now, this client admitted that she had failed another drug test, and the counselor had now recommended that she be given a higher level of care, which would be inpatient, a 30-day inpatient program. When the client heard this, she got angry, but this isn't the first time that she was offered this. But the waiting list for an inpatient in New Jersey is very high, so it would take a couple weeks, and it's just not really fair because in those couple weeks she's going to continue to keep using. So the client just kept saying that she is her sober support. She doesn't need anyone else. She is here today and she's clean today. But she also told us that her kids were taken away and put in the care of her sister. And now that her kids are taken away, she still doesn't need inpatient. That she can do this through outpatient. But as myself and the counselor were telling her, obviously the inpatient is not what she needs. The outpatient is not what she needs. She actually needs the inpatient. But she does not want to go away for 30 days, but because she already did that. But clearly the outpatient isn't working for her. So all the other group members started to give feedback to her. There was one client that was really angry at herself for her own problems, and she was basically screaming at the top of her lungs, saying she doesn't care about anyone else's problems, that the counselors are hard to trust because all they do is report when they use a drug, but that's what they're supposed to do. They're mandated reporters. They have to look out for the client and the best interest of the child. The child should not, or children should not be in the care of a parent that is using. So another client stated that it took her almost 2 years to get her child back, and she also had an alcohol problem. This client was crying. That a new client that just started a day ago was crying, and we asked her why she was crying, because she has custody of her children. She just has to work on herself. And she said she was just emotionally upset because she doesn't want to lose her children. Now, at this point in time, every single person in the group is crying. Everyone, except two. The counselor and one other client. The client that wasn't crying was looking around like this, looking at the floor, looking at the walls, looking at the ceiling, and I was watching her. But I could tell that she wasn't interested in crying today, so she was like not paying attention. Now all the other clients are sobbing uncontrollably, getting tissues, going like this with their shirt. It was just a very emotional group. Now the client that we were talking about going to inpatient started to get really heated and upset. She started yelling at the counselor, saying that the counselor called DYFS and reported that she was using and didn't even tell her. And that the counselor always said that she would tell you before she's going to call. But after the 4th drug test of failing, the client should have had an idea that the counselor was going to be calling, because that is her job. It's against the law not to report it. But the client was very upset with the counselor. The client told our story about how she got neglect charges and how they were dropped and how she spent time in jail, and that she was lucky that she didn't do more time than she did. She only did a month. But the client was saying that she is her own sober support. That's all she kept saying. I am my own sober support. I am my own sober support. I am my own sober support. Now, the client does not like to go to AA or NA meetings. The client comes to group mostly all the time, except if there's an emergency or a doctor's appointment or something like that. The client has a mother and a boyfriend who she states is her support. But she doesn't have former addicts as a support, which is important because they can understand better. Like, her mother is old and doesn't understand the disease of addiction. Now, we're pretty sure that her boyfriend is not a good influence for her. She has not admitted it, but we're basically sure that he might be a cocaine dealer. It's just an assumption that the counselors have come up with by listening to her story and all that stuff. But now the client, now that she doesn't have her children, she doesn't know what she should do, but she feels that she needs the help, but going away isn't what she wants to do. So another client who did the IOP program with her, moved to the continuing care, also tested positive for drugs. She tested positive for methamphetamine and was dropped back down to the IOP level. So they've been on a journey together for a long time because they were both in IOP, went to CC, and now back to IOP. Now, this client has not admitted her use to methamphetamine, but she also has not tried to get out of the IOP program. So it seems that she did use, but won't admit it. So she's going to be staying in the IOP program for a long time. Now, these two clients are very close because they spent months and months and months together, and the client was trying to get was very upset, very distraught. She was crying. She was trying to convince this other client that she should go to inpatient. So then all the other girls are trying to convince her to go to inpatient. The one client said, "What's 30 days if you can have the rest of your life with your children?" Now that really struck me in a way. Exactly. What is 30 days in an inpatient to show the courts that you're trying to, you're going to be away from your children anyway because they're not in your custody. But we couldn't make the client understand what's 30 more days in an inpatient, and then you can come back to the IOP program, complete that, do the CC program, and we can put this all behind her. I think it's because the client isn't ready to be done using. She's back into active addiction. Now, maybe using one time, we would have had a better chance of getting out of addiction, but now it's in her mind. The drugs have entered her mind. Her brain is back into addiction. It doesn't care about anything else. It might be her body is sitting in the IOP program chair, but most of the time in group she's going like this. It's either because she's using still, it's because she is high in the group, which is bad for the other clients because other clients can point out when somebody's high. They're addicts. They know exactly who's high, when they're high, what they're doing, where they're going. They can tell. Now so one of the other clients was like, it wasn't even 11:30 yet. And that's like when they take break, around 11:30 to 12, they take a break. And she was like, one of the clients that had an outburst earlier, "I need a cigarette, I need a cigarette, I need a cigarette. This is too emotional for me. This is too much." And the focus wasn't even on her, but because the girls are so close together and they were all crying, it was emotionally bringing them all down. So, but they weren't going to give him a break yet because they wanted to keep, other people in the group wanted to keep talking. And this is when I'm looking around the room and I'm seeing everyone crying except the counselor and one other girl. And I could feel myself like wanting to cry. And I don't even know why. This isn't my life. I didn't lose my children. But I felt so bad and sympathetic for these girls that I didn't know what to do. So I started looking at the floor. And I was just looking at the floor and I was trying not to listen. And then I could feel a teardrop and I was like, this can't happen, this can't happen. You can't cry in front of clients. Like, is that even a thing? Like, are you allowed to cry with your clients? I mean, obviously I wouldn't be crying if they weren't crying, but I had never seen so many people cry in one time that wasn't a funeral. And nobody was dead here. Everyone was just crying because this woman that worked so hard just lost her children. And there's other girls in the room that have lost their children, got their children back, lost their children, don't have their children currently, or they do have their children currently. There's just so many different background stories going on. And the client was still stating that she doesn't need to go to inpatient, that she will keep doing this, and she has court tomorrow, and they're not going to tell her that she needs inpatient. But little does she know that when she goes to court tomorrow, they are absolutely going to tell her that she needs to do inpatient, go back to IOP, and then finish what she started. It's a disease, and she relapsed. A lot of people don't realize that drug addiction is a disease, that people give this disease to themselves. But now, drug addiction is in the same category as diabetes, cancer, all that. So, during break time, the girls go outside. They're all still crying. And I look at the counselor, and she could tell my eyes are watering, and she told me that it's absolutely fine. You get emotionally attached in this situation. So the client that we were having like this little intervention, she comes back into the room, and she's still saying she doesn't want to do inpatient. And the second half of group, one of the girl that had the big outburst, she didn't come back. Now, Is it because it was too emotional in that group? Did she go and relapse? We don't know. But the second half of the group, an NA speaker came in, and at this time, the counselor took out the client that was saying, the one that just lost her children, that had the cocaine and alcohol, took her out into the hallway, talked to her about an inpatient, and she said she would consider it. Now we don't know if she's actually going to consider it. It's more of a wait and see, or if the court tells her she has to, then she's going to have to, or she'll be non-compliant and she'll never get her children back. But so the NA speaker came in for the second half of group, and you could tell that the clients were emotionally drained. After the speaker spoke, did her presentation, told her story, it was time for questions and answers, the session. And I was sitting in the back of the room, all the clients were in front of me. And the client that did not cry, raised her hand and was the only one that asked a question. Everyone else was too emotionally. They even said it. They're like, the first half of the group was so emotionally, like, we're not trying to be rude, but we don't feel like talking. So that was what happened in the group. This is the client that I chose. She relapsed with cocaine. She told us that she went to Camden. She was in an abandoned crack house getting the cocaine, and then she used the cocaine one day, and then it made her want to drink alcohol, which is her real drug of choice. She still thinks that she can get over this because in between the 4 positive drug tests, she had 2 clean drug tests, so she thinks that she can just pick up and stop when she wants to. But if that was the case, she wouldn't have had 4 positive drug tests, and her children wouldn't be taken away. So at this time, we're just waiting to see what happens in court. She will most likely have to go to an inpatient, and hopefully she'll be able to get her kids back together. But it was just so much to deal with in one day. It literally ruined my entire day. Like, it was nice to be able to confront the client, and I guess she kind of understands that she relapsed and that she needs an inpatient because she said she would consider it. And all the other clients were able to give their feedback, but it was so emotionally draining for the clients and myself because I'm just so compassionate about what I'm watching here and the IOP and drugs, and just watching all these women cry because of the mistakes they made because of a drug addiction. It was absolutely insane. I never thought I would see that many people crying at one time. And I never thought when I started this that my emotions would be, that I would be crying because I'm watching other people crying and hearing their stories. Like, that's not my life. Why should I be crying when it doesn't even involve me? But it does involve me. And now I learned that this is serious, and I can't wait to go back after the 4th of July and see if the client's going to go to inpatient, and I can't wait to see her when she gets back from inpatient because I'm sure she'll be coming back to the group and it'll be great to see.